One of the exciting new areas that we at Grand Strand Health are getting involved in is transcatheter mitral valve repair or replacement. This is the next frontier as far as transcatheter techniques are concerned. There's only a handful of programs in the country that are involved. We've actually already done it here at Grand Strand, and we're looking forward to being at the forefront. Similar to transcatheter aortic valve replacement, when we do transcatheter mitral valve replacement, we're delivering a valve inside the patient's diseased valve, and we're doing it without opening the chest. But the beauty for the patient is they don't have to have a chest incision to have their valve replaced. After transcatheter valve procedures, including transcatheter mitral valve, patients are expected to stay in the hospital for about 48 hours. If you have a mitral valve that's not working well and we can replace it with a transcatheter technique, you're going to return to full health in a much shorter period of time than you would after a traditional open heart operation.